So tell me about your approach and your philosophy when it comes to facelifting.
So the most common thing I get from women who come into my office is that they've spent a lot of time and energy and money with youthful creams or whatever on their face. And they've taken good care of their face, and so their face is pretty good. They're happy with it.
Okay.
But what they're upset about is that their neck is giving away their age. Either they've got really thin, crepey skin of their neck, or they've got a turkey neck from sagging skin, or they've got platysma bands from the muscle that's right behind the skin. And so they feel like their neck is giving away their skin.
Can somebody's neck be too far gone, by the way?
No, never.
So you could always help them?
You can always help.
Okay.
Absolutely.
All right.
No matter how thin or thick the skin.
So take care of the neck first, if that's a problem.
Yes, yes. So with that, the neck lift, the same incisions through a short scar facelift. Okay. And so that also addresses the jowls, because the neck, the frame of the neck is really the jawline. And so through there, we readdress or we reposition the SMAS, or the fibrofatty tissue that's underneath the skin. So we don't rely at all on the skin to pull the face smooth or tight.
Okay.
It's really taking the fatty tissue of the jowl and pushing it back up to where it is. A lot of times these patients say, I had a really nice heart-shaped face when I was young. Now I'm sad and kind of square looking with a really square. So readdressing, and then as that goes, then you move up in the face, and the next place is the cheeks. They have hollow cheeks. They have a flatter profile from the cheek fat drooping down, and that's what also causes the laugh lines or the nasolabial folds. Sometimes a lot of times it's very popular now to fill those with filler. I tend to not like to do that unless it's very subtle. What I want to do is address why that's there and really fill their cheeks, either with filler if they're not a surgical candidate, or that can actually be done with fat grafting, autologous fat grafting, or that can be done just by repositioning the fibrofatty layer that was there. Once we do that, sometimes that does lead us further up the face to the patient's crow's feet and the wrinkles around their eyes. This can tend to make it a little bit worse once you pull everything up, because it all squinches up into the eyes, and so that does have to be addressed as well. The lower eyelid incision is the way that I like to address the mid-face the best. The mid-face includes the eyes. A lot of times we think of our face, the eyes at the top of our face, but if you look at your head, your eyes are actually in the middle third of your head. And so that area is all addressed together. And the brow is really just the frame of that. It's the frame of your face, but it actually sits fairly close to the center of your head. And so that sometimes, depending on where they are, it should be right up against the brow bone. And if it's not, it has a very nice eye-opening effect to put them there, or maybe slightly above, but certainly not a surprise look.
Now, the done look. I guess everybody's worried about looking done. One of my friends, his wife, he's thinking about a facelift. He's begging her not to do it because he doesn't want her to look done. So tell me, they must ask that on your consults.
Absolutely, absolutely. That's their biggest fear. I hear it every day. They say, I just don't want to look, I want to have plastic surgery, but I don't want to look like I've had plastic surgery. And I completely agree. I think
and you can accomplish that.
Absolutely. And the way to do that is not to rely on the skin. Most of the time they do that. If you pull the skin tight, it will look good for a little while, but skin stretches. It's got great elasticity. It's why women can get pregnant and have their bellies shrink back. It's why we're capable of so many different things. But with time, if you just do a subcutaneous or skin-only facelift, it will all droop, and which is why surgeons do tend to pull the skin really, really tight because they don't want a relapse. Correct.
So that's going on out there. There's a lot of skin pulling being done by plastic surgeons.
Unfortunately.
And you don't like that?
No. I think that the skin should just merely be redraped to get the wrinkles out, to get the excess out.
But you're repositioning what? The underlying tissues up?
Absolutely. The fibrofatty tissue underneath. It seems like they would
all do it that way.
It's not hard to do. It is a little bit more risk because the nerves run directly under there, and so the safest way to accomplish a facelift, if you don't want it to last a long time, is just a small tuck with the skin.
Okay, good. So the natural-looking facelift, that's your specialty.
Absolutely.